Okay, it's time for an update. Let's see, it's March 30th, and I just came back from my visit with my oncologist, and let's see, it's a good 3 months, more than 3 months, really. 3 months, like, I don't know, and I guess almost 4 months after my last chemo. And because I'm a research guinea pig, I see him much more often than any ovarian cancer patient would go back. So I see him monthly. And my blood work was weekly. First it was every 10 days, now it's weekly, now it's monthly. Yay! So I wanted to update mainly to tell you that my CT scan we did with contrast, which I am allergic to, but I got pre-medicated so we could do it for the study, was negative. And my CA-125 is also in the normal range. It's been a 1, sorry, those of you who've had really high numbers. It's now a 2, which doesn't mean it doubled, it means it's very low. So that's all good. I'm continuing to take the PARP experimental drug. I'm pretty sure I'm on it because every now and then I still get pretty nauseous and like heady. Not really dizzy like spinning, but sort of like lightheaded, heady, what I call it. I had it for about 8 hours the other day, and I was out of the house and I didn't have my little rescue me Zofran, so I waited. When I got home I took it, and within 20 minutes it went away. So I'm thinking that might mean that I am on it, and I haven't had a recurrence yet, thank God. So I do want to point out though that I've never had a positive CAT scan, or PET scan for that matter. The only thing that ever showed up on a test like that were 2 what looked like tumors on my liver that ended up not being there at all, which is ironic that the 100 to 150 small tumors that were in my abdomen were not picked up by any of those tests, but 2 tumors, sizable tumors, were picked up on the liver, but in the surgery, when they got to look at the liver and ultrasound the liver, there were no tumors. So I don't use that test for me it's not very reliable, but we use it because of the study. Okay, the other thing which is really important to me is, and to a lot of you guys out there, is the problem of libido. I have talked to and been in contact with hundreds of other cancer patients who have had hysterectomy and are no longer taking any kind of hormone replacement therapy whatsoever. And I have yet to find anybody who has a sex drive anymore. And, you know, for those of us who are young, and yeah, I'm 44, and there are people as young as pre-20-year-olds, 20s and 30s, who are having this, you know, procedure. It's not cool, and it really it sucks. Okay, so I have had this conversation many times with my doctor. I have a very cool relationship with him. I can really tell him anything, and we discuss it almost every time I'm there. And today, I guess the dust has settled in terms of it's been 3-4 months since I finished chemo. You know, my immune system's getting better. Starting to get back to somewhat of a normal life, which that's a whole other topic. But so he came up with an idea today, and he said Viagra. And I thought, great, cool, what's that going to do? And he said, this is cool, let's try this. Increased blood supply to the pelvic area, let's try it. Okay, great. Well, it might be good for you guys, but I happen to have an autonomic dysfunction that causes hypotension. My blood pressure is abnormally low already. I take medication to raise it. And if you know anything about Viagra, you have to have a minimum of 100. Well, we can't give nitro. Let's put it this way. When you take Viagra, your blood pressure drops. And when Viagra first came out, we were getting a lot of patients that were just dying, men that were taking Viagra, older men. A lot of them also had angina and were taking nitroglycerin for chest pain. Nitroglycerin drops the blood pressure. The two together equal blood pressure so low, not compatible with life. So the bottom line is I can't take Viagra because I already have a low blood pressure problem that I am being treated for with medication, and it's working. So that's out for me. But if you're one of the people out there suffering, you might want to talk to your doctor about Viagra. That really sounded like a commercial, but I guess I should be bummed for myself, but at least I feel like it was a step in the right direction, and my doctor's at least willing to talk about it. Right now, he's not willing to sign off on any kind of hormone replacement, which testosterone is the drug that really gives you back your, what's it called? I can't think of the word, but increases your libido. Mojo. Gives you back your mojo. So, right now the jury is way out, and there's just no compelling evidence that supports doing it safely. He's afraid that it could increase the activity of any kind of cancer cells that are there, that want to proliferate. So, that's out. Anyway, I'm going to sign off here, and hope everybody's well, and let's make some videos. We need some other people making some videos out there. We need some videos about ovarian cancer patients, primary peritoneal cancer patients. I'm tired of these commercials for the hospitals and the drug companies and the, public service announcements. Let's get some real people talking people. Let's go. Okay, I'm going to be looking for your videos. Peace out.